Now, can we talk a little bit about you?
Sure.
Because I want to inspire, my mentees, my, students with your journey as well. Can you tell us a little bit about your journey?
Sure. So, like you have taken an unconventional path, moving out of clinical practice to academia, research, and working with big pharma into medical affairs, evidence generation, and then took a bit of a tangent to digital health, going with the bandwagon of the world going digital and worked with digital therapeutics. Again, the idea was same, that if I actually see X number of patients in a day, that those are the only number of lives I'm impacting. When you work with pharma, sometimes you figure that every new molecule that you launch creates a big impact, right? Because if you are working on a cholesterol medication, you are impacting all the 1 in 4 patients who suffer with heart disease. So when you want to impact at scale, I think you need to do things at scale, and that's where I transitioned to pharma, transitioned to digital health, because again, digital is what provides scale. That hunger for creating impact is always there, and that rush to do more and more in a short span of time. So digital worked well. And then I tried and dabbled at entrepreneurship with again the AI hype cycle, and tried to again develop patient programs wherein we are helping patients, providing them one-on-one AI counselors which can support them, because we know that patients have 100 questions to ask and doctors don't have more than 100 seconds.
Yeah.
And then how and whom do they ask? So how do you create credible information? Like you spoke of AI avatars and things like that. It's about giving that kind of support system. But and then while doing that, I figured that my true calling probably lies within medical affairs, within research, within bringing more medications to patients, impacting their lives. At the same time, talking to my peers about research, about newer molecules, therapies, and guidelines, and seeing how we can change that, bring more access at various scales. So that's been my journey so far, and goes with the entire same vision of creating impact at scale.
So, what's your view of AI? What kind of impact can it actually create? And whatever's happening right now, a lot of doctors are really scared. What is this happening? Is it going to take away, patients? Is it going to take away our freedom and all of that, right? How do you think they can work collaboratively with AI?
I think one first starts with that AI is not a magic wand. I mean, people look at it that way, that it solves all problems. Two, there is also a lot of skepticism. Again, for doctors, I would say it's not a monster, right? It's not going to eat up anything. Neither going to eat up your practice, your patients, not going to make you redundant. When technology came in, everybody thought of that, right? I mean, if we go back in years, we heard that when computers came, they thought everybody would be jobless. And then we came with smartphones and more digital tools and wearables getting converted to watches, to now rings, and now you have AI embedded everywhere. It's about how you collaborate, the way we did with smartphones. Probably 20 years ago, you and I would have never thought we would have had the whole world in our pocket. But now it works. It works so well that you can't live without it. It's so easy today for a doctor to just send an X-ray or an ECG on WhatsApp. For a junior in the hospital, just send it, and you are just sitting somewhere else and doing that. We saw in COVID how digital health actually changed lives. How an app like COVID could give access to vaccination and run the biggest vaccination drive in the entire world. So technology is not our enemy, and what doctors need to understand is that you need to understand it the right way, because it's integrated in our lives today. Today you and I are both using ChatGPT for different reasons, and many other AI platforms, right? For different reasons. It's about how you learn it, how you utilize it, and make the most of it. Whether you want to give your redundancy admin tasks to it, whether you want to utilize it to gain knowledge or to test something, or whether you're going to utilize it, in terms of bringing about a change or knowing where it is going wrong. I mostly tell doctors, when I talk about AI to medical professionals, I tell them you don't need to know what is right with AI, how it works. You need to know when it goes wrong.
Yeah.
You know, what is going to fail, because in healthcare the onus lies on you. You know, technology always had a delete button.
Yeah.
But doctors never had that choice. You can't say sorry and get away with it.
Yeah.
So you need to learn the right things, so you know that AI is not being misused by patients, not being misused by others, or technology is not doing the wrong things, you know, without keeping you in the loop. And that's why when you spoke of an incubator idea, I think it's very key that doctors get involved very early when it comes to technology, because a lot of health tech and AI today is being done by tech experts
Yeah.
and not being done by healthcare professionals who don't understand, because for them it's a data point, for you it's a patient.
Yeah.
So, and that's a big valley which only doctors can fill.
Yeah, I mean, it's all about how you utilize it like an assistant, or let it run your practice for you, or you know. But what I tell people in my community is that AI can never replace you, is one thing. Second is that uh, you know uh, they need to understand how to use it and not fear it, right? And third, and the very most important point is that as AI takes over the world, the humanity in each person becomes even more important. The human touch becomes even more important.
Absolutely.
Right? It may be possible that it's giving you more time with the patient, right? How do you utilize that time to build that relationship? How do you utilize that time to make their journey simpler, right? All of these things are still in your hands. So you still have a role to play. Actually, it's not just in healthcare, any industry.
Anyway.
I feel like the whole building relationships, the role of HR is going to increase. The role of all of these things are going to increase, right? And um, nobody needs to fear AI, according to me.
Right, absolutely.
Yeah. And the role of communities is also going to be
Even more
bigger. Yeah, because they're going to be lonely. They're going to be clueless. With people losing so many jobs, they have to now find what else they can do. Yeah, so healthcare that way is sort of resistant to this, layoffs and all, mostly, at least till now. But yeah, but I see this, pattern everywhere else, trend
True.
everywhere
It's
else.
about evolution, I think.
Yeah.
And when we evolve, and also we need more people, because today we hear people, using AI as a therapist, using AI as coaches in many, many ways, and a lot of it just feeds into sometimes what you want to listen.
Yeah.
But it's about, that sense of belonging, that sense of community is missing maybe at many places, and that's why people are resorting to chatting and talking to a machine. I'm sure humans are social animals and they don't want to talk to machines. They want to talk to other humans, and I think building the right set of community and the right kind of people around you is what's going to make all the difference, right? On us navigating this entire volatility around and uncertainty of AI.
So, I mean, there are many young students out there, graduating out of medical school, dental school, and all of that. Um, as someone, who has taken that unconventional path from the beginning, right? Ever since you passed out, can you give some advice to them?
I think one is, it looks very nice sometimes, but you have to be prepared for it. And it's a mindset change, because it's difficult for doctors or healthcare professionals to themselves think of them without a stethoscope or without a clinic, right? The same conditioning is by the society, and that pressure is going to keep remaining with you forever. That, oh, you're a doctor, what do you do? That whole thought of me explaining to people every time what do I do, and them probably not getting it, thinking, oh, what are they doing? Like, how are you not working in a hospital or a healthcare setup? It's going to be a challenge for you for your whole life. So get into it with that right mindset. You need to understand whether, what, like you said, finding your superpower and thinking big. If that's what you want to do, you must do it. If you do it as an escapism that, oh, I'm not successful here and hence I want to do this, may not be the best thing for you. So I think fitting yourself into that entire mold of doing an unconventional path is the first step, and probably the only advice that I'll give, because everything else will fall in place if you have that right mindset of why am I doing this, and what do I aim to achieve with this? Most people enter without thinking on either of those lines. It's about you do go with the flow. Of course, you can't plan and predict everything in life, but if you don't have that mindset that I want to do this and this is why I'm here and this is what makes me happy, you're never going to be happy. So make that choice, by giving a lot of thought.
Also, I feel like you're a very positive person that exudes a lot of confidence, as well as you have this ability to attract people, right? With the person that you are, with the being that you are. What are your practices that you follow, whether it's spiritual practices or any other practices that you follow? What is your mindset like? Maybe it can inspire many people.
Sure, thanks. So, people say that those who smile a lot sometimes have a lot of sorrow within them, and things have evolved, I think, with every difficulty that I faced in life. But what kept me floating, I think, I'm very spiritual and religious as a person, and God's been my therapist forever. So, that works well. Two, I believe in acceptance of the situation. That is what has changed and kept me more positive all the time, that this is not in my control, and whatever this is, I have to accept it and live with it. And you have only two options of living. You can either smile your way through it, or you can keep crying or cribbing. And if you cry, I think you cry alone. And then, like you said, the energy is then going to attract only pessimism. And if you smile your way out, you don't figure, it's all a passing phase, and I think when my mother was during her last breath, she always kept reiterating the fact that whatever happens, happens for good. The Almighty knows why He is doing this to you. It's just that you don't have the patience, nor do you have the foresight to understand that in this moment, this is what you want it to be. And that's been my approach. And I try things so that there are no regrets, because later you eventually will feel that maybe I could have. And we all have this mindset of being smarter in retrospect and being smarter when you're put in others' shoes, saying if I was in that place, I wouldn't have done it. But you don't know that what probably you did in that place was what you had to do. So when people ask me sometimes questions like, what would you go back in time and change, I would say nothing. Because at that moment, that was what I would have done. It wouldn't change the course of action, because today you are smarter. 5 years later, you feel, oh, maybe I shouldn't have taken that step. But that's learning over 5 years, which you got because you took that step. So if you go back and change that, probably, those 5 years wouldn't come and you wouldn't get those learnings. So that's the simple thing that I follow. I know people expect from me as a healthcare professional that maybe talk of techniques like journaling or mindfulness or things like that. I think do them subconsciously maybe, but don't follow them very consciously. I think it's just spirituality, I think, keeps me afloat.
Going by my superpower X-ray, right? I was just doing that to you right now, and I feel that you still have a lot to achieve. You're somewhere midway, like you're figuring out things, and I feel like you have a lot of greatness to achieve, and you can create a big impact. You don't know what it is, but I know what is coming.
Next time, I trust your superpowers and I trust the power of the universe, and let's see where this leads me and leads us to where we go, and how this unconventional path, what is the end destination of these unconventional paths, is something we are yet to figure, and let's see if either of us are able to give closure to that unconventional path.
We have big dreams, and I think at least the heart and the passion to achieve it, and we are doing the right things, I guess. Let's see how it goes.
Great.
Thanks a lot for inviting me, and thanks a lot for your time.
My pleasure, and this has been a very interesting conversation.
Yeah.
And again, wish you all the best.
Thank you. Wish you the same.
Thank you.